in relation to the issue of the amount of paediatric tracheostomy patients in Ireland, and also the number of registered nurses who are able to perform the operation and the procedure, and how many of those are in the hospitals around the country, and also how many are able to show parents how to perform the procedure as well. There has been some tragic cases in relation to this over the last while, where because of the parents' inability to perform the procedure, that children have unfortunately died, and in some cases, when looking for assistance from nursing staff who haven't been properly trained in the procedure, that tragedies have occurred. And I just asked the Minister maybe to outline to the House what the government are doing in relation to ensuring that as many of the healthcare professionals throughout the state are properly trained, properly qualified, and that a programme and a procedure is in place to ensure that the tragedies that have occurred in the past in Kilkenny and in Cork do not happen in the future. Thank you.
I would like to thank Senator Daly for bringing this matter before the Seanad, and they were assured that the Department of Health and Minister Cathy Lynch are bringing it to her attention. In answer to the Senator's specific questions in relation to the number of paediatric tracheostomies, if I got these words mispronounced, apologies, and nursing care, I would like to put the following on the record of the Seanad. Information available from the Hospital Inpatient Inquiry Database would indicate that the number of children between 0 and 16 years who have had this procedure and have been discharged from hospital is a relatively small number. Of the 74 such discharges between 2010 and 2012, the majority have been from Crumlin's Children's Hospital, 41, and Children's University Hospital, Temple Street, 21. However, it is not possible to say how many of those children were discharged with the tracheostomy still in place. The active register of the Nursing and Midwifery Board of Ireland has a total of 4,274 individuals holding a children's paediatric qualification. This does not mean that all of these are actively practicing in this discipline. Individuals may hold more than one qualification and as such may be practicing in another division of the register. It is also possible that individuals may not be practicing at all, but still pay annual retention fees to maintain their names in the register. Under new requirements set out in the Nurses and Midwives 2011 Act, future registration will capture more defined information in relation to current employment. This will allow for more accurate analysis of the active register, including numbers of practicing paediatric nurses. The HSE established a working group to examine the discharge of infants or children with complex healthcare needs from the acute paediatric hospitals in Dublin and Leinster in July 2012. The group comprised reps from the paediatric hospitals, HSE Primary Care, nursing agencies, Jack and Jill Foundation, Laura Lynn House and UCD. The group is finalising its report and will submit it to the National Director for Quality and Patient Safety. Findings indicate the need to establish a clinical governance model for children discharged into the community, the need to ensure that all staff providing care to children with complex needs are fully trained, and indicate the need to develop a support package for parents. It is proposed that these recommendations will apply throughout the HSE. A key recommendation concerns the need for a detailed paediatric home care package to be agreed prior to the child's discharge from hospital, with a detailed specification outlining the care requirement for each individual child and family. A paediatric home care package needs to include a key worker to advise everyone within the family on all aspects of the child's care and trained nursing care staff. The provision of safe home care for children who are well enough to leave hospital, such as children like these, is a priority for the Minister for Health. The Minister has highlighted care at home for children who have had to undergo tracheometries as a priority service area for the HSE in planning their service in 2014. The Minister is meeting the advocacy group tomorrow. The HSE has informed the Minister that following publication of the National Service Plan for 2014, officials will meet in early December to discuss future steps to deliver on the working group's recommendations in 2014.
To Sauce, are you happy?
I don't know, Lesker here, like I'd say.
You were brief supplementary now, so.
This is and obviously I'd like to thank the Minister, and I know this is not his specific area, and I wish that the Minister for Health would come into the House, but just for the record, what I asked was to clarify the number of paediatric tracheostomy patients in Ireland, and to clarify the number of nurses who are competent to carry out and to train in tracheostomies and the procedure itself. And the answer in brief was, it is not possible to say how many children were discharged with tracheostomies in place. That was one answer. And the other answer, which in a page and a half, was basically, we actually don't know how many nurses are trained to do this. I think maybe the Minister might clarify as to whether I'm getting the wrong end of the stick, but in the page and a half that he was given, there was no answer to the question. It was 2 pages that basically said a lot but said very little. And again, Minister, I'm not obviously saying this in relation to yourself, but in relation to the reply that was given by officials in the Department of Health to a question put down by a member of the Oireachtas, that in fact in 2 pages the question was answered in 1 line, which was, it is not possible to say how many children were discharged with tracheostomy still in place. And I think, given the fact that I asked the question, you'd wonder why they're not able to say that. I think that's a worry in itself. And the other part, which was in relation to the qualification of nurses, that they actually don't know the answer to that either, which was the long way of they went around and made you come in here instead of being honest about it and just saying, do you know what, we haven't a clue. Well, I think that would have been the best answer they could have given. And I'd ask the Minister to go back to the officials in the department and say, as you as a public representative, I don't think it's acceptable that any public representative would be given an answer that was as disgraceful, I'd say, as that is. And I don't blame the Minister for Health or yourself in that regard.
Your lack of pleasure with